I'm Dr. Katie Peters, and I am here to tell you a little bit about mom wrist. This is really common in those first few months postpartum, as we're not used to picking up our baby a ton and doing all of that caretaking, and our wrist tends to get really sore, especially right along this thumb area. So let's talk about things you can change while taking care of baby. When thinking about taking care of baby, it's important that we're keeping wrist in a really neutral position. So when picking baby up out of crib, try not to bend wrists up and down in this direction. Keep wrists really nice and straight. When holding baby, try to avoid this repeated patting motion. Try to keep, again, wrists really nice and neutral, and more of a neutral wrist as you pat baby's bottom. When holding baby, again, try not to keep your wrists bent. Try to be in a little more of a neutral position as you are holding baby. It's all about keeping the strain out of your wrist when caretaking. Start paying attention throughout the day when you're picking baby up off of the changing table, when you're getting them out of the crib. Notice what your wrists are doing. When you're sleeping, you can even wear a night splint so that you're not sleeping with wrist all curled up, but that can make a big difference first thing in the morning too. Okay, let's talk about some exercises that you can start doing today that will help your mom wrist. Grab yourself either a lacrosse ball or a foam roller and start rolling out your forearm on the front and back side. So you can just put the ball at the countertop and roll out all through here. A foam roller works really well for this also. Both sides. The next thing that you could be doing is working on stretching these areas. So what you're gonna do is you're gonna turn your hand upside down and go ahead and pull it straight down. Take some nice deep breaths as you feel that stretch. Okay, you're gonna hold each stretch about 30 seconds. You're also gonna make a fist, pull down, and then twist your arm inwards until you feel a stretch through here. Okay, now this next stretch might be the most sensitive. You're gonna just cup your thumb, okay, and gently pull downwards until you feel a stretch. Now, we don't wanna create pain, just a gentle stretch. Okay, hold for 30 seconds. I also love to have my patients do some nerve flossing for their upper body when they have that mom's wrist. So this is a super silly exercise, but it works really, really well. You're gonna go ahead and make those old-fashioned glasses that you used to do in elementary school, and you're gonna straighten your arm. You can do one at a time or both. Straighten your arm and bring it back. You should feel a little more intense of a stretch when you get here, and then bring it back out. Now, don't forget about your upper body. A lot of times our wrists are actually bothering us because our upper body is so tight. So make sure that you are doing some upper body mobility. I love to do a few different thoracic stretches. Okay, sitting on heels, and we're gonna do a windmill. So it's just rotating up to the side and coming back to the other side, okay? While I'm in this position, I'll also do a cat-cow with my heels seated, or with my bottom seated on my heels. And then lastly, make sure that you are stretching open your chest. As you're nursing or feeding baby, we tend to really start rounding, and this can really actually be quite irritating for our hand and wrist. So grab your foam roller,
lay on your back with your bottom at one end and your head at the other end. Bring your arms up in goalposts and just hang out in this position. Take some deep breaths and relax as your chest opens.
And that's a routine for mom wrist. If you're still having symptoms after doing that for a week or two, reach out to us and we would be happy to help you.